I'm Dr. Barry Levine. I'm a board-certified dermatologist, and I wanted to announce tonight that we have a new tool in our belt to help treat and fight acne. And I can tell you that I'm extremely excited about this technology, and we're also excited to be one of the first in the country to offer this to our patients. Again, acne is much more common in areas where we have increased sebaceous glands like the face, the neck, the chest. And the sebaceous glands are the oil-secreting glands that make a product called sebum, which moves up our follicles and comes out on the skin. However, there are times when these pores can get clogged and they can trap that sebum in there, which causes acne. In addition to that clogging, you also have bacteria on the skin that migrate down this follicle, and when they get involved and intermixed with this sebum, create significant inflammation, and that's where you get the redness and the discomfort that comes with it. So what's different about the Accure Laser, however, is that it targets the sebaceous gland things. One is they had to figure out how to cool the skin and the epidermis and the dermis so they wouldn't cause damage to those areas, but also they had to figure out what they call the peak epidermal temperature, is how to get that energy down to that level and create that denaturing of the sebaceous glands. The laser comes on the epidermis. It has a special handpiece, and when it cools the epidermis to a certain temperature, the laser beam is emitted in pulses to target just the oil-secreting glands. The epidermis, the outer layer of the skin, and the dermis are protected from this cooling mechanism, so you're not creating problems such as scar tissue. And so you're putting all the energy where it needs to go. Histology of skin, you can see the different layers here, but down in here you're going to see the oil-secreting glands or sebaceous glands. In this type of skin where they're enlarged, you're going to see a lot of sebum coming up. After treatment, you can see where they're denatured, and these have shrunk down significantly, and you're not going to have that excess of sebum that is coming up that follicle and has a propensity to get plugged. So they've proven this in their studies by histology, which is really important. We can treat any area that is involved with acne. So most commonly it's the face, but we can treat the neck, we can treat the shoulder areas, the chest or the back, all the areas that are acne prone. Generally, it's done as 4 treatments, and what they noticed that after the first treatment, there was already a 40% improvement in the majority of their patients in their FDA clinical trials. With each subsequent treatment, they got significant more improvement to the fact that after the 4th treatment, most of these patients had over 80% improvement in their acne. That is equivalent to what we normally see with people that are on Accutane, which has previously been our gold standard, that it appears to be durable. So these patients' results seem to last. I think the data is out to almost 3 years now where these patients have maintained results, which is very exciting. We have a few pictures here. These are from some of the clinical studies, and you can see the patients have had significant improvement of inflammatory acne. When we're doing a treatment, how does this work? They come into the office, their face is cleansed. Then you have to use a topical anesthesia. So we put a topical numbing medicine on, generally for approximately 30 to 45 minutes, because we want to make that area comfortable while we're treating. Once we have the numbing medicine protocol completed, it's cleansed off, and then we do a grid pattern on the face. And that's to make sure that we have adequate treatment of all the areas that need to be treated. So it's all mapped out with a grid. Protective eyewear is placed on the patient as well as all the staff, and all safety protocols are utilized. We then start the treatment, and we follow out this grid pattern to make sure that we're evenly treating all these areas. A treatment takes approximately, depending on the area, approximately 45 minutes. When the treatment is done, the face is cleansed again. We use sunscreen and we give them instructions how to take care of it. We understand that it's a financial commitment to have laser therapies, and the approximate pricing on this depends on the area that is being treated. For example, a full face is approximately a $3,600 to $4,000 amount, which includes the 4 treatments. So we worked with a financing company to try and make it as accessible to our patients as possible. And we can get this down to an amount that's affordable for most patients, in that $100 to $150 a month. We are very excited about this technology. We're excited about helping people with acne because we think it'll make a very big difference in the lives of our patients. Thank you.